I see them twofold: the immediate threat, the acute threat of the virus, and that is pretty much how stable is our immune response, and understanding the evolutionary patterns better, such that we understand quickly what in the weeks to come we expect with respect to the burden of new infections. And there a lot of surveillance is needed, and this will always be a question, and we just need to collect the data at all times to know what happens in the or what might happen in the near future. This is one part, and the other big part is the more long-term chronic effect, and those are all the questions around long COVID. We still don't even have a very good definition of what long COVID is, and we don't have good or treatment options for those patients. And so a lot more research needs to go into the phenomenon of long COVID to understand what causes it and how can we help patients. So I found very fascinating to see how actually the rather basic research on virus evolution can feed into public health policies. What we also realized during the pandemic, though, that it's not a given that the science feeds into policy, but we need to establish and work on maintaining the dialogue between the basic research and policymakers, such that we can actually use the evidence which is there at all times in the most beneficial way. So at D-BSSE, in the pandemic, I think we have shown how we actually can contribute to public health. So there were several groups doing a lot of research at the forefront, doing research, say Nico Bärenwinkel's group, supporting the wastewater surveillance, Sayreddy's group, supporting the testing and sequencing developments. And so at D-BSSE, we have shown that we have technology in-house and expertise to rapidly react to a pandemic threat. And so through that, we also established connections to policymakers in Switzerland, but also have connections internationally with other scientific advisory boards, policymakers. And I think we should now use the time to maintain those connections which we established, and in the future further provide our expertise, and so make BSSE a reliable partner for public health questions.